ask the
I'm
question
going to
or?
make introductions. I'm going to make Greetings, audience. My name is Sumi Cheng, and I'm an instructor at Toronto Metropolitan University, a researcher and a not-for-profit executive. I'm very pleased to be partnering with the Ontario Nonprofit Network to create this web series entitled Leading Through Austerity, Diverse Voices. This web series features interviews with diverse women leaders in Ontario's nonprofit sector, serving equity-seeking population groups, exploring the leadership challenges and opportunities arising from austerity within the sector. Before we proceed any further, I'd like to acknowledge that I live and work in downtown Toronto on the traditional territory of the Mississaugas of the Credit, the Haudenosaunee, the Anishinaabe, and the Huron-Wendat, lands covered by Treaty 13 and the Williams Treaties. As a settler whose family arrived here through migration, I honor the Indigenous peoples who have cared for this land since time immemorial and recognize the ongoing impacts of colonialism. I commit to relationships and actions rooted in respect, reciprocity, and responsibility. With that, I'd like to introduce my guest, Suzanne Obiorah, is a recognized leader with over 25 years of experience in public health, social services, and municipal governance. As the Chief Executive Officer of Somerset West Community Health Centre, she is dealing with some of Ottawa's most complex public health challenges, including housing and homelessness, mental health, and racial health equity, while contributing to broader social policy at the provincial and federal levels. In her leadership, Suzanne has spearheaded transformative initiatives across Ottawa. These include leading Ottawa's Black Health Plan, implementing Ottawa's first 24/7 community-based crisis response, advancing the specialized clinic for refugees with complex needs, and launching Ottawa's first homelessness, addiction, and recovery hub. She's a co-founder of the Ottawa Black Mental Health Coalition and previously served as the City of Ottawa's Director of Gender and Race Equity. While she led the development of the city's first anti-racism strategy, Suzanne brings extensive governance experience serving on the boards of Addiction and Mental Health Ontario and the Alliance for Healthier Communities. In recognition of her impact, she was inducted into the Order of Ottawa in 2025. So welcome, Suzanne. Thank you so much for agreeing to be a part of this interview. Let me begin by asking you to tell us about how you got into your position with your organization, and in brief, what does your organization do and who does it serve?
Thank you for that, Sumi. So I've worked in health and social services for 25 years in a number of different settings, starting in the community health center setting, and have now full circle found myself back here. And I have found myself back here because of how closely connected our organization is to serving a diversity of communities and how fulfilling it is to observe the impact of the work that we do directly with the communities that we serve. So we are a community health center. We serve over 18,000 clients yearly. We are supporting individuals and communities to experience their best health and well-being from a health service lens, from a social service lens, from a community development lens, from a health promotion and health activity lens. And so it's quite fulfilling to be able to engage in a number of different ways with communities that experience marginalization and work alongside them to to ultimately achieve their best health and well-being.
Thank you for that. So, this web series seeks to explore several key issues in the not-for-profit sector, and one of the most significant is austerity. There are several definitions that exist, and I'll offer up the OECD one. Austerity measures refer to government actions designed to reduce budget deficits through spending cuts, tax increases, or a combination of both. These measures have significant consequences for the not-for-profit sector for obvious reasons. Within the current context of uncertainty and affordability, in your own opinion, does austerity exist in your sector and why?
So I think I'll take a step back to share that oftentimes in the nonprofit sector, um, we are we are often doing more with less, and we are doing more with less because the needs are great and they're complex. And so what what I think what happens is um, many organizations are trying to receive adequate funding to respond to the needs and are faced with um, reality is that there isn't sufficient funding available to address the need. And if we want to maybe bring that forward into defining austerity, I think what that means is that scarcity becomes normalized. And the consequence of that is carried by communities, by staff, by leaders who are faced with holding some of the most complex social realities of our time and being unable to turn away from addressing them. There's a significant moral distress that comes with seeing a problem and then not being able to address it. And I don't think that's unique to this time period. But what is likely unique is that we know more about complex social realities, related to homelessness, mental health and substance use challenges, newcomer health, gender-based violence, poverty, racism, and so on and so on. We know more socially about these issues and yet have not been able to advance the social policy or the infrastructure that we need to keep pace with these challenges. And so the austerity tension rises as the work still continues. Folks in our community are continuing to seek support, and staff and leaders and communities are then meant to absorb it. And it hasn't been sustainable. And it continues to be one of the greatest challenges of doing this very powerful and meaningful work.
Thank you so much for sharing that with us. And we do thank you for your continued leadership and the work you do. So, how have you found its influence when it comes to some of the day-to-day challenges you face as a leader for your organization?
Yeah, and what we see in our organization are individuals who are deeply connected to the work. So there's a significant job satisfaction that individuals experience. Most folks enter into, the healthcare sector or the nonprofit sector with the hope to serve. One of the hardest parts of leading in this context, though, is that we hold many truths. Communities need more. Staff are working to exhaustion. It is more expensive to do all the things that we aim to do to respond. Funders want innovation. And sometimes there is a mismatch between the investment to align with the innovation. And sometimes it's not a need for innovation. There are very strong evidence-based practices that need to continue to resolve longstanding issues, and they won't resolve with short-term funding commitments. And our boards need assurance that we are responding, and leaders need to make very responsible decisions in an environment where sometimes the math the math doesn't add up. So it puts pressure on recruitment, on retention, on morale, on organizational sustainability. And it does, really force us to think about making some difficult decisions on where we put our internal energy and resources to be sustainable.
Can you speak to the competitive nature of the not-for-profit sector and how it's impacted partnerships and allyship?
So one thing that we've done here in Ottawa, we being a number of community organizations, have started to refuse competing against one another. Ultimately, that competition leads to a weakening in our collective voice, and we further fragment or dilute. We further fragment our potential and we dilute our efforts as funders, understandably want to fund a number of organizations, and then perhaps provide less so that every organization gets a little piece. But that doesn't necessarily advance some of the broader goals. So here in Ottawa, we've really worked hard at collectively submitting funding applications with commitments to work in collaboration. And some of our larger or more better resource organizations have been using their influence to work and collaborate with some of the smaller grassroots organizations that might be Black-led or newcomer-led or women-led to engage in access to funding, and then and then ability to facilitate change within their respective communities. And I think that's a very tangible allyship that we're observing in action, where it goes beyond the words of solidarity to really look at how we're redistributing power and protecting the conditions that we need to do the work that we seek to do in our community by choosing to work in collaboration. That was a deliberate choice that we've made in response to existing systems. And so I think there's some questions there around, how we revisit the systems for communities that may not have the opportunity to work in that collaborative model.
I just wanted to kind of go back to your earlier comment. I mean, I think it sounds really great that you and your peers and colleagues in Ottawa have kind of taken this very deliberate, unconscious decision and approach to kind of counter the environment that the competitive approach to funding can create. And I wondered, because you did make some comments about how the competition can weaken the collective voice, can dilute some of the efforts. I wondered if you could just speak a little bit to how the current context that you operate, for instance, in Ottawa, what you're seeing and why, and how, in terms of how that drove your decision and your peers' decision to kind of really counter that context that you're operating under.
So traditionally, the landscape in the nonprofit sector is funding opportunities present themselves, and organizations are looking to build, the best funding proposal to acquire an amount of that funding. Some organizations are better positioned to engage with grant writers. I mean, this is before the uh, AI and things like that. But what we were seeing is some organizations had the capacity to engage grant writers, had capacity to perhaps set aside staff to put proposals together, and other organizations who were equally well positioned, or maybe even better positioned, to advance some of the equity agendas that we're trying to advance. We're not able to do that because of a lack of infrastructure and funding. And I know that this reality continues to exist. I'm speaking about some very deliberate choices that were made here in the city of Ottawa to really put allyship in action by choosing to work in collaboration and choosing to share, in some instances, a larger pool of resources to kind of break that pattern of diluting our efforts by receiving insufficient resources to address what we know to be significant needs in our community.
Thank you so much for that elaboration. So I want to touch on the notions of resilience. So resilience is a term that's used a lot in the not-for-profit sector. It's defined in many ways. I wanted to offer up a definition that's been put forward by an acquaintance and a colleague of mine, Professor Emeritus at Toronto Metropolitan University, John Shields. And he said that resilience has been defined as the ability of entities to withstand, adapt, and recover from periods of difficulty, sudden shocks, and crises. What are your thoughts on organizational resilience, and how has it translated for your organization?
Yeah. I have a very complicated relationship with the word resilience. Our organization serves a diversity of communities that experience significant vulnerability and marginalization, and we see resilience every day in individuals who choose to wake up every morning and persist or persevere through poverty, persevere through homelessness, persevere through mental health and substance use challenge, persevere through severe trauma that they experience, whether it's within their home or a country that they have left. And so the word resilience is complicated for me and this organization because we witness it every day in the strength, in the creativity, and the leadership that exists within our communities. And I don't believe that communities should have to face endless amounts of racism or poverty or housing insecurity or policy decisions that make their lives harder. I would challenge that resilience really needs to be built into the policies, the systems, and the infrastructure to reduce harm and facilitate greater capacity and potential for systems to appropriately address needs in our community. As an organization, we will always continue to adapt and pivot in an effort to best serve our community, but would like to also look upstream at what potentials exist around how we shape our systems to be resilient in the face of, a number of system inequities that we see.
Do you find that resilience prevents you from being able to look upstream because focused on the now?
I wouldn't say that resilience distracts us. I think, what I'm saying is that we see resilience every single day, and we are equally prepared to come to the table to talk about, creative, new, or innovative ways to set up or influence social policy, creative and innovative ways to talk through adequate infrastructure to counteract things like homelessness and poverty. There is not any one organization that can address some of the social determinants of health that are creating vulnerability. Somerset West in and of itself, for example, cannot address homelessness, but we can work to creating resilient systems in partnership with the provincial government, the municipal government, our community partners, housing providers, et cetera, and would like to broaden our conversation of resilience to go beyond a community or an organization to really building resilient systems.
I see. Did you want to comment on any actions your organization has taken with regards to being a resilient organization, in addition to the fact that, of course, you're serving clients who are demonstrating their own resilience on a daily basis?
One of the elements that I'm most proud of about our organization is that we hire directly from the communities that we serve. We have one of the most diverse workforce, from frontline staff to our leadership, executive leadership, and board. And that really enables us to apply our lived experiences, our established trust and credibilities with the organizations that we serve to appropriately design, adapt, and respond to the diversity of communities that are seeking our services. So we hire folks that have experiences of homelessness. We hire folks that have experiences of fleeing war-torn countries. We hire folks to reflect the racial diversity, the gender and sexual diversities, the language diversities that exist in our city, and I would argue that has created a very resilient workforce, and one that's reflective of our community and enables us to make very good decisions that adequately respond to the realities that we see among the clients that we serve, and has equally increased our credibility, not only within our community, but has increased our credibility and influence to engage in conversations at a system level, at a regional level, at a municipal level, at a provincial level.
Great. Thank you so much. So there are so few diverse female leaders or women leaders in the majority of the non-for-profit sectors. It can be inferenced to be as low as 10% and under of all non-for-profit executive leadership positions. What do you think needs to happen to see greater diversity and inclusion in not-for-profit leadership? And how has austerity had an impact on this?
Yeah. I have been so fortunate to have access to incredible sponsors who understood the value that I could bring to varying conversations that speak to the realities of racialized individuals in the mental health system, for example, or Black women in leadership. And so it really needs to start with a value alignment and leadership to identify and advance um, access to diversity in leadership, but equally to set up individuals for success. I refute conversations around equity hire. Oftentimes, individuals that are racialized are overqualified or extremely qualified and have often shared their experiences of having to work 2 times as hard to be seen as equal, and worry that we have, in many ways, diluted the true meaning behind the advancement of equity and its understanding, which puts at risk the success and sustainability of individuals that come from a diversity of backgrounds. But if we believe and understand the power that exists around representation in leadership and understand how that advances any agenda in an organization, then I think we all have to independently choose to ensure that that's taking place within our spheres of influence through sponsorship, through development, through engagement. I have taken that responsibility personally because it had been afforded to me. And I really do believe that there will be a pay it forward model that helps to minimize the lack of representation of racialized individuals in particular in leadership roles.
Thank you so much for that. And thank you for your own commitment and efforts towards advancing diversity, equity, and inclusion in leadership. With that, I wanted to ask you, what advice would you give to emerging diverse leaders who want to work in the not-for-profit sector?
In anything that we pursue, I think it's really important for us to start with our why. Why is it that we want to engage in said role? What is it that we are trying to achieve? And be really clear on our sense of purpose and what we bring. Why? Because the work presents a number of challenges. The work presents a number of challenges in the context of scarcity of resources, which we've been talking about. The work is challenged with, certainly in the nonprofit sector, a number of social inequities that we are presented with on a daily basis. And each decision comes with a consequence that's not easy, needing to live with it. And the work also involves limitations around representation. And I think naming those is a start to help with navigating through it, and not naming it to suggest that there is a victimization or a victimhood that comes from it, but it's really knowing and learning and understanding that environment and thinking about what you want to bring to that environment and what more specifically you want to change, and seek the support systems that you will need to navigate some of those very difficult realities.
Thank you so much for sharing that. So before I conclude this web interview, I wanted to ask you, do you have any famous last words you'd like to offer up to the audience?
Oh man. um, one of my favorite from the phenomenal individual who is Maya Angelou, and I may not quote this well, but it is one that anchors me oftentimes, and it's People will often forget what you do, but they will never forget how you made them feel. And just an extension to that, it doesn't cost much for us to be kind.
The fantastic ending. Thank you so much, Suzanne. It's been a real pleasure having you on this web interview, and I've really appreciated you sharing your thoughts and views on leadership, on the non-for-profit sector, and on the needs of your clients and the experience of the client and lending them a bit of a voice in today's interview. That's been deeply appreciated. I've also been very appreciative of your own very directive and focused commitment to advancing representation, diversity, and inclusion, all for the sake of course, advancing equity. So thank you so much for your own leadership in that space. And thank you, audience, for joining us. And we look forward to having you at the next leadership interview session. Take care. Bye.
Thanks very much.